Welcome back to the Tropical Nurse Talk, Healing with Local Wisdom Podcast Episode 2, with today's topic, Common Tropical Disease. Hello, I'm Grace, your host for today. We will be discussing 3 of the most common tropical disease in Indonesia. Our guest in this episode is Dr. Faizatul Roshida, MCAT, who is a doctor and studied tropical disease for her master degree.
Thank you very much for the introduction. I'm so happy for your invitation to join this podcast and discuss tropical disease, which remain a public health challenge in Indonesia. I hope our conversation today will be useful for our listeners.
Okay, Doc, as we know, Indonesia as a tropical country has many unique diseases. Can you explain what common tropical disease we usually find?
Let us now examine 3 major tropical diseases frequently encountered in Indonesia, each representing a different class of infectious agent, virus, bacteria, and parasite. These are dengue hemorrhagic fever or DHF, tuberculosis or TB, and malaria. All 3 remain significant public health challenges. First, we talk about dengue hemorrhagic fever or DHF. Dengue hemorrhagic fever is a viral illness caused by the dengue virus. It is transmitted by the bite of Aedes aegypti and Aedes albopictus mosquitoes. Clinically, DHF is characterized by sudden high fever, myalgia, arthralgia, nausea, rash, and in critical stages, you can see a progress to hypothalamic shock due to plasma leakage. Although no specific antiviral treatment exists yet, 2 dengue vaccines are currently available. However, dengue vaccination has not yet been integrated due to administration rules. In clinical nursing practice, the role of the nurse in dengue management includes early recognition of warning signs such as high fever, red spot, malaise. And the second one is tuberculosis or TB. Tuberculosis is an infectious disease caused by the bacterium Mycobacterium tuberculosis. Primarily, it is affecting the lungs. Transmission occurs via respiratory droplets released when an infected person coughs or sneezes. Nurses also play a crucial role in TB management, acting as treatment observers, health educators, and patient advocates. Particularly in undeserved areas, community nurses are vital in case detection, treatment, and mitigating social stigma associated with TB, such as TB is a curse or TB is a disease of the poor. And the third is for malaria. Malaria continues to pose a serious public health threat in Indonesia, especially in eastern regions. It is caused by Plasmodium parasite. Transmission occurs through the bite of infected female Anopheles mosquitoes, which thrive in forested, humid, and high rainfall environment. Geographical challenges and limited healthcare access remain major barriers to malaria elimination. From a tropical nursing perspective, nurses play a central role in active case screening, management of both uncomplicated and severe malaria, and also empowering local communities in prevention efforts.
Okay, so why do these diseases spread so easily in Indonesia?
Because Indonesia has all the elements that support the spread, including a tropical climate, densely populated areas, poor sanitation, and disparities in healthcare services. Warm temperatures and high humidity allow mosquitoes and microorganisms to thrive, Meanwhile, the theory of eco-social epidemiology explains that disease spread is not just about pathogens, but also the result of interaction between the environment, social structure, and access to healthcare. Factors such as poverty, uncontrolled urbanization, and public health behaviors, such as delaying treatment or relying on an alternative medicine, all play a role. Therefore, tropical diseases spread not only because of mosquitoes or bacteria, but also because our socio-environmental systems are not fully prepared to fight them.
Okay, this tropical disease is also a global issue, isn't it?
Yes, indeed. Tropical diseases such as dengue fever, tuberculosis, and malaria are not only public health concerns for tropical countries like Indonesia, but they have also become central issues in global health. Many of these diseases are categorized as neglected tropical diseases or NTDs by the World Health Organization. Now let us examine them one by one. First, dengue fever, for instance, has now spread to more than 100 countries worldwide, especially across Southeast Asia, Latin America, and Africa. The rapid expansion of its geographic distribution is driven by climate change and also accelerated urbanization, which create ideal breeding grounds for mosquito vectors. The WHO describes dengue as one of the fastest spreading tropical diseases in recent decades, posing an increasing threat to both urban and also peri-urban population. And for tuberculosis or TB, it remains the deadliest infectious respiratory disease globally, claiming more lives than any other single infectious agent, while the majority of TB cases are found in low and also middle-income countries. High-income nations are not immune, particularly due to factors such as migration and weakened health system in undeserved population. And the last one of the neglected tropical diseases is malaria. Although successfully eliminated in many parts of the world, it continues to be a leading cause of morbidity and mortality, particularly in sub-Saharan Africa, South Asia, and eastern regions of Indonesia. Malaria is not merely a mosquito-borne illness. It reflects deep-rooted inequities in healthcare access, system resilience, and also health justice. These three diseases, dengue, TB, and malaria, are all considered neglected tropical diseases because they persist in the shadows of global health attention. Their control and eventual elimination will require cross-national collaboration, spanning research, vaccine development, factor control, diagnostic innovation, and also strengthen public health infrastructure. Addressing NTDs is not solely a matter of treating infection. It is a matter of global equity, calling for integrated, sustainable solutions that bridge gaps in poverty, education, and healthcare delivery.
Thank you, Dr. Faiz, for sharing such insightful information about dengue fever, TB, and malaria.
No worries, Grace. I hope it broadens students and nurses' knowledge about tropical disease. Thank you for having me here.
Yeah, you're welcome, Doctor. That's it for today's podcast. See you in the next episode. Stay healthy and keep your spirit up. Goodbye.